Hello, my name is Peter McDonnell. I'm an ophthalmologist in Baltimore, Maryland. I'm also chairman of the Wilmer Eye Institute and a professor at the Johns Hopkins School of Medicine. I'm also a chief medical editor of Ophthalmology Times. And the people at Ophthalmology Times told me that they'd like me to present some information about what's happening at Hopkins and what we're doing at the Wilmer Eye Institute to deal with the situation we're in now, which is obviously unique in the careers of certainly my career and the careers of most of my colleagues. What we've done is contact patients who are scheduled for our clinics if they have elective issues that do not require prompt care. We're asking and encouraging them to reschedule somewhere in the range of 1 to 3 months from now. We're also rescheduling all our elective surgeries. We're continuing with the surgeries where we feel that a delay in care for our patients would be potentially result in worse outcomes for them. We screen at the front door of Johns Hopkins Hospital and the Wilmer Eye Institute. We make sure our patients are afebrile. We ask about history of respiratory or flu-like symptoms. We are not asking about travel. Our epidemiologists tell us that ship has sailed. The virus is now in the community and it's no longer so closely tied to international travel. So we can't use that as a screening device. We limit people to have one companion with them for their visits and one visitor if they're inpatients in our hospital. Our nurses are making sure that our doctors, our residents, our staff are very comfortable with use of the personal protective equipment that they will need if they're seeing any patients suspected or with confirmed coronavirus infection. We have special negative pressure operating rooms where we can perform surgeries in those patients. As I said, if the surgery is not elective and needs to be done on an urgent basis. We pulled medical students off their clinical rotations, which is a big deal, obviously, for Johns Hopkins Medical School. But the belief is that at this early stage in their learning careers, they probably should not be caring for those individuals with the virus. And then we have a couple hundred people involved almost entirely in research. They're working from home. And as much as possible, our schedulers, our call centers, our administrative people are working from home to try to minimize the risk. I would say it's very inspirational to walk around Wilmer. We have a very marked reduction in our volumes of patients in our clinics, but all the people that need intravitreal injections are getting their injections. All the people that have pressures way too high are getting their pressures taken care of in our clinics and our operating rooms. And it's very nice to see people really step up and care for the people that need the care that they need to get. So I'm very proud of the staff, the nurses, the doctors, the residents working at Wilmer, who are calmly going about their work and leading by example and reassuring the patients. One thing I'd say is I'm very appreciative of the opportunity to work with the people I work with, how they have stepped up to take care of these individuals that need care. While there's all this report in the news and causing anxiety in the public, people that say that this younger generation is not as hardworking and disciplined as our older generation, I think if you feel that way, you should come and spend some time with my young House officers, and I think you'd feel much more confident about the future of our country and the future of medicine. I read an editorial in one of the major newspapers this morning where the writer said that when the history of 9/11 was written, the heroes were the firefighters and the first responders, and when the history of this viral epidemic is written, it'll be the people who work at the hospitals in our country, and I think that's true. And I'm very proud of my colleagues, how they've stepped up to take care of these individuals who need our help and make sure that all the retinas get reattached and everything gets taken care of. So on behalf of everyone at Ophthalmology Times and everyone at my institution, I of course wish you and your family all the best during this stressful time, and hope if there's some way that we can be helpful to you, we can do that. Thank you very much.